An episiotomy is an incision that is made during childbirth on the vaginal opening to widen the vaginal canal for easier passage of the child. Hi guys, welcome back to my channel. I'm Maria, a nurse by profession. Today we are talking about episiotomy care at home. An episiotomy is an incision that is made during childbirth on the vaginal opening to widen the vaginal canal for easier passage of the child. Many mothers, especially first-time mothers or even second-time mothers, experience an episiotomy during childbirth. However, most times we are discharged, we go home and we do not know exactly what to do. So these are the things that you can do and the things that you do not have to do if you get an episiotomy. An episiotomy, first of all, is performed by either a midwife, a doctor, or a nurse during childbirth. The things that you should do before you leave the hospital: make sure that your incision site has been repaired, or what we call suturing. It must have been repaired before you leave the hospital. These are the things that you could do at home. The first thing that you have to do is maintain a proper hygiene. Maintaining proper hygiene comes in a wider package. It comes from showering at least twice a day so that your body is clean. Then to keep the episiotomy area clean and dry. How do you keep it clean and dry? Change your pads oftenly. At least every 2 hours you should be changing a pad. Every time you go to the washrooms, you could make sure that after, use a wet towel or a wet cloth to pad at the place so that you do not use toilet paper, which could cause infections if a particle of a toilet paper remains on that wound. The other thing we have to do is you could urinate under warm water or cold water, because as you urinate, you might get some urine that falls on those wounds and it is painful. The only way you can relieve that is when you're going to urinate, you could use a basin or a bucket with water and you urinate over that water. It relieves that pain that comes with urinating when you have a wound or an episiotomy tear. The other thing you have to do is wipe from the front to the back. Do not wipe from the back to the front. As you wipe from the back, you might bring other organs to the wound from the stool that you pass, and you cause infections at that site. Then these are the things that you do not have to do if you have an episiotomy. Most times mothers come to hospitals with tears. The episiotomy places have failed to heal. When you ask them what happened, they tell you they've been washing with soap. Sometimes you wash with soap excessively, which hinders with wound healing and sometimes breaks the sutures. The other thing you don't have to do is do not fail to take your medications. Sometimes we are too lazy to continue with the antibiotics for at least 5 days. Then you find that the wound became septic or it got an infection and you ended up not healing. The other thing that you do not have to do if you have an episiotomy is to try to sit in excessive warm water with salt. Some people use the salt excessively. They use salt water, sit in it, but that excessive salt water, what it does, it causes corrosion around the wound. Then the wound does not heal. And the other thing that happens, the sutures might come out still. So as a mother at home, make sure that if you have an episiotomy, you make sure that sit in warm water with very little salt. Salt that you as a person can be able to take in food or drink in water. Do not use too much salt or what they call the bitter salt. It could affect your wound healing. Then the other thing you don't have to do is not eating a balanced diet. We know that a balanced diet with fruits, carbohydrates, proteins helps and rejuvenates the body, heals it better and helps in wound healing. So if you do not eat a balanced diet, you might not help your wound to heal faster. Then the other thing, do not stay at home if it starts gaping. Gaping is breaking. If the wound starts breaking, If you notice that your wound is not healing well, do not stay home. Go visit a health facility, talk to your practitioner, tell them what you're going through, let them have a check on you, and let them repair if they have to repair, prescribe an antibiotic if they have to, but do not try to see if it will heal on its own, because those wounds are clean wounds and are expected to heal in a specific amount or number of days. Thank you so much for watching. See you next time. Bye.